like to talk to you about screening echocardiograms. And I will start by telling you what an echocardiogram is. An echocardiogram is simply an ultrasound of the heart. There are usually some conditions or cases or symptoms that need to be investigated by the doctor. And sometimes the decision is normally made that the symptoms are relating to a heart problem. So in such a case, the doctor will order for a couple of tests. And one of the tests that the doctor will ask for is usually an echocardiogram. Now, when an echocardiogram is ordered and you come to our facility, we'll simply be able to clerk you. And by clerking, I mean talk to you and ask you a few questions to understand your medical condition, and then prepare you adequately by helping you change into a gown, and then explaining to you the procedure, which is a bit long, by the way, and going ahead to do the procedure. We use an ultrasound unit. Like here at ScanLab, we have a very good ultrasound unit that has got very good capabilities in cardiac imaging. And after we capture the images, we store them on the equipment. And after they have been stored, we look at them later as a team and escalate a report for you that you can be able to go to the doctor and get to be seen. And therefore, a management plan can be decided for you. Now, most people normally think that an echo is something different from an ultrasound, and most people confuse it with an ECG. The echo is a scan of the heart, and it helps to check the structure and function of the heart. The ECG only looks at how the heart is beating, the electrical conductivity. You might be wondering, who is this person who does an echo, or what would a patient be having for them to be eligible to do an echocardiogram? So I will simply just talk about the few things that people normally experience in terms of heart-related issues that can be able to form part of the patients that can come for echo. The first one is usually chest pains. And in this case, we are talking about pain in the chest that originates either at the center and radiates to the left, either the arm or the neck. The other symptom could be things like difficulty in breathing. The other thing could be when you are asleep, you wake up with a feeling of choking. You feel like, not choking rather, but strangulation. You feel like you can't breathe. You feel like somebody had actually stuffed a pillow on your nose and you cannot be able to breathe properly. We can also have echo as a screening tool for people who are doing athletics, things like football, things like rugby, people who cycle, things like climbing mountains. You need to be sure that your heart is working well before you can be able to go do those exercises. Why? Because they are very strenuous and your body will have a lot of demand for blood supply and nutrients, and therefore your heart must be working well for you to be able to go and undertake such activity. The other things are related to things like if you have hypertension or if you have diabetes, and also things like if you've had a medical condition that is heart-related for a period of time. The commonest in children is normally rheumatic heart disease. And this is normally children who present with very chronic fevers, a fever that does not go away. If it is because of a rheumatoid factor, then as you grow older, the heart might be affected by this rheumatoid factor, and you could have a damaged heart. The valves of your heart can be damaged, and therefore you can be eligible to come and do the examination. So at ScanLab, luckily, we are able to do both diagnostic and screening echocardiograms, and there are costs that have been tailor-made for those two particular scenarios. And listen, you can walk in anytime and consult on us, and we'll be happy to attend to you. So long as you fit the criteria to have the echo, we'll definitely advance the service to you. Thank you very much.